All right, my lovely. Take a really big breath. So if you just have a look at this chart. If you could just pop that over your head, you're looking a lot calmer. Tonight's video is kindly sponsored by Raid and Shadow Legends. Freeze and stop whatever you're doing and take a breath. Don't waste your life. It's time you made some changes. Explore millions of champion combinations and master countless tactics as you take on raid bosses, dungeon runs, campaign battles and PvP arena matches. With hundreds of artifacts to equip and over 500 champions blessed with unique skills, you can build your team, develop your champions and raid your way. Use my links below to download Raid yourself to your mobile phone or PC. There are so many things that I love about Raid. It's hard to decide what I love the most. As you know, I love summoning champions and leveling them up, but at the moment I'm really enjoying working on my clan boss and my arena team. So what's new in Raid? And this month Raid's got a jam-packed schedule of events to kick off the summer, as well as a load of new content. And as always, they've got a bunch of brand new champions coming out, and every single one of them looks absolutely amazing. There's also a new rotation of the Doom Tower, and I'm really hoping I can actually do the higher levels of the Celestial Griffin. So I'm going to be trying to summon as many of these new champs as possible to see if they can help me reach the top. Raid's always got a lot going on, and this month isn't any different. So don't wait around and don't miss out. If you want to get a huge head start in Raid, all you have to do is hit the link in the description or scan my QR code and you'll get an epic hero, Gennaro, who is amazing in the Doom Tower. 200k silver, 1 XP boost, 1 energy refill and 1 ancient shard, so you can summon an awesome champion as soon as you get in the game. And all this treasure will be waiting for you in here. Once you're in, you can find me in the game under the name Be Brave, Be You. And if you're fast enough, you can even join my clan. And it is that simple. Just click on the links in my description box and I'll see you in the game. Hello, lovely. I'm Nicola, and I'll be taking care of you today. Alright. So, I have your report here, and I can see that the paramedics brought you in today. Is this your family member? Hello, lovely to meet you. Yes, that's perfectly fine. Just take a seat. All right. Now I can see that you're having a little bit of difficulty breathing. So I'll try not to ask you too much, but if I do need to know anything, please feel free to just let me know. So, if you could just confirm their name and date of birth. Great, thank you. So, let me just have a little look. understand what you've been experiencing now. How long has this been going on for? Okay. Has it got quite extreme? Has it calmed down a bit, or it's okay? Okay. All right. Okay. Don't try to talk too much. So it is good that it has eased off. That's what I like to hear. Do you suffer with anxiety or panic attacks? Right, okay. I have to check because sometimes people are experiencing panic attacks and they get anxious about that, and it's a vicious circle. But I'm happy with that. So that would indicate to me there's probably something to do with your lungs. Alright. Are you asthmatic at all, or have any lung issues? Alright. Has anything like this happened to you before? No? Alright. Don't get upset, lovely. It's alright. So everything's going to be okay. Here. Yeah, take one of those. There we go. Right. Have they give you any nebulizers or any oxygen or anything at all? It's a little bit of oxygen, that's fine. Do you think that helped? That's good. So with the chest pain, if you could show me roughly where it was. Yeah? Anywhere else? What about your back? A little bit. Alright. Were they quite in pain? Have they had any paracetamol or anything like that? Yes, just what they had in the main room. Alright, that's fine. Do you think that helped at all? Not really. Okay. So, you're a little bit dizzy. Was that when you couldn't breathe more, or? Yeah. Right. I am wondering whether it's possibly maybe an onset of asthma or something. I will check your blood pressure and your pulse. I would like to make sure that it wasn't anxiety related. But don't worry, I'm not going to just say it's anxiety and not do any checks. Alright, if you have an issue that could actually trigger the anxiety, and that's where you get the vicious circle. Okay, good. So I'm going to carry out some tests now and just give you a thorough exam. Nothing to worry about at all. Alright, I'm just going to check you and make sure that everything is working as it should. Alright, my lovely. Can you just take some nice steady breaths, okay? Go in through your nose like so. And out through your mouth, okay? Do it with me. And again. Alright, if you can do a couple more for me. Great. If I could get you to just raise your top for me, please. Thank you. So I'm going to have a listen to your chest. If you could just breathe normally for me. Thank you. It will be a little bit cold. You're doing well. Just nice breathing. I know, don't worry. Don't worry. Just do the best you can. I'm just going to get some around the back. Alright, if you could just take some nice deep breaths for me. Alright, so in, hold, and release. In, hold, and release. And again. In, hold, and release. Again. That's good, perfect. And another. Hold, and release. And one more for me. Alright. Getting back to normal breathing. Alright. I'll pop your top down. You are a little wheezy and there is a slight little bit of crackling. Alright. Have you recently had any flu, any colds, or any coughing? Alright, so no. When this started, were you experiencing any coughing then? Alright. Did you feel quite tight and like you were gasping for air, and when you took a breath in, it felt more extreme? Any pain or shooting pain down your arm? Or I know you said you had a little bit of tingling in your hands, but nothing in your arms. Alright, that's good. Have you experienced this kind of pain or sensation before? A couple of times at night, and that's just recently. Okay. You're alright. You're doing really well. Okay. So I'm going to check your temperature. I just would like to see if possibly you have a fever and any signs of infection. I'm going to pop this on your forehead. Okay, that's fine, that's good. So, I'm now going to check your pulse. I know you had this done in the ambulance and it was quite high, so I'd like to check it now. Things have calmed down a little bit. So if I could have your index finger, please. Okay, just pop it there. Okay, just relax and nice normal breathing. Much better. There we go. Happy about that, but I would just like to check in your neck, if that's all right. Thank you. Perfect. That's all good. Right. So let's check your blood pressure. So I'm going to get you to pop your arm in there for me. Just pop it on the side for me. So this one will go quite tight. Yes, it is a little bit. Perfect. It's absolutely fantastic. Right, my lovely. I'm just going to have a little look in your eyes, if that's all right. Now, this will be fairly bright. You can just look at my nose or the back wall. All right. Yeah, it is bright. Good. Wonderful. Just going to get you to look up for me with your eyes. Okay, if you could look that way for me. Okay, look that way for me. Back at me. How's that? Your eyes are looking really good. Alright, a little bit watery, but that can be expected in this situation. Alright. So, have you ever done a peak flow before? Right, I'm going to get you to do one of those. So this is a peak flow. Now, I need you to take a really big breath, okay? Hold it and then just like that, but really hold the breath out as much as you can when you blow it out. All right, really need to get in there, and it might hurt you a little bit. Yeah, just do the best you can. Okay. So I'm going to get you to hold this, and if you can just pop it in your mouth and make sure your lips are sealed right over the tube. Yes, like that. Perfect. When you're ready. Not quite. We try to do that again for me. Nice deep breath. That's it. And when you're ready. Okay, that's a bit better. Just right, a bit more effort. That's better, but still quite low. Just one more go for me. Give it all you've got. All right, I'll take that. Thank you. It's quite on the low side. We're looking at around an average of 200 to 250, okay, which is definitely on the low side. And we have a different lung capacity to each other, all right, and how much air and oxygen we have in our lungs. Now, somebody who is asthmatic will always have a much lower peak flow. And at times, if we have an infection or a cold, flu or anything like that, the peak flow could be much lower. All right. So I am a little bit concerned about the peak flow. To jot this information down. Right, can you just take a deep breath in for me and hold it? Keep holding it for me. All right. Okay, you can release. Did you have any pain? Whereabouts? Okay, so right, just going to have a little feel of your chest. You can just raise your top for me. Thank you. Is it hurting when I'm touching? Good. I'm going to reach around. Any pain? Good. Okay, that's fine. Pop your top down. And you're not red or anything like that, so that's good. Have you got any sore throats or anything at the moment? Good. Right. No, I don't think it's anything to do with the heart. No, it's definitely the lungs. Yeah. So if you just have a look at this chart, right. So we have 2 lungs and we have a bronchial tree. Now these look a little bit like cauliflowers. That's what I always call them. And you have the primary bronchus and the secondary one and the segmental one, and then we have the bronchioles. Okay. So these can become inflamed, all right, and with a patient that is asthmatic, you will find that they are inflamed and you're not getting enough oxygen in your lungs as you should be, and there could be some inflammation around, and you've got your windpipe, okay, then up through the trachea. Now I'm going to have a feel around your throat, okay, so I want to feel around your trachea and your larynx, okay, just to see if there's any swelling or anything. And I'm going to have a feel of your glands and your sinuses, if that's all right. Good, I'd just like to check. So obviously we have the nasal septum, which can get inflamed, and your sinuses can as well. Okay, so do you smoke at all? Right, okay, so here we can get inflamed sometimes, all right. So just have a look with that. So this is the bronchopulmonary segments, all right. So different areas of the lungs can become inflamed and infected, all right. You can have a thing called bronchitis, all right, or bronchial asthma, or we could have just other forms of asthma, all right. I'm wondering whether you have a little bit of bronchitis, but I'm also wondering if you actually have asthma, okay, or you could just have a flare-up of bronchial asthma. We could treat that and then it may calm down. All right. Yeah, so it's quite interesting to see where we have the larynx, and that can often become narrow, usually if you're a smoker. And we have the different sinuses here and here, and they can become inflamed and swollen, and if you experience sinusitis a lot. Have you ever had that? Okay. And with people with hay fever and things like that, they become inflamed and blocked. All right, and sometimes that can restrict how much oxygen we're having in our body. I don't think there's going to be anything wrong with any of those, all right, but I would like to just have a feel around just to be on the safe side. Okay. Do you have issues with your throat at all? Any pain or random swelling? Sore throats a lot? Have you got your tonsils? Okay. All right. Any issues with your tongue? Any ulcers or anything like that regularly? Okay, so it all sounds really good. All right, I don't think there's anything wrong there. But it is always good to check, all right? Yeah. So obviously the respiratory system can be quite complex. All right. But I would definitely say there's something going on with your bronchiole and these different ones here. All right. So this here is just some soft muscle, yes. and that is the alveolar sac. Alright, so I'm wondering if we're a little bit inflamed here, and if these are inflamed as well. Yeah, which is usually if we are asthmatic or something, or if you have COPD and things like that, COPD. But if that is the case, I would have to get you to a specialist, alright? Yeah, and they will carry out a lot of tests appropriately with you for your lungs, okay? Yeah, it's probably better that I refer you to one anyway. I am thinking that you have got asthma. Yes, I think that's right. I definitely think I'm going to give you a short course of some antibiotics that's going to treat bronchitis. Alright, and I'm going to give you an inhaler, and the inhaler will obviously help calm things down as well. Alright, and if it is bronchial asthma, that should be able to do the trick, and sometimes it eases off after a month, 2 months, sometimes a little bit longer. Yeah. And then if I refer you on to a specialist, they will be able to carry out the proper appropriate test, and they can look at your larynx, your sinuses, and obviously your lungs. They can do a scan, see if there's any shading or anything like that, or anything that they are concerned about, and they will carry out some basic asthmatic tests and things like that. Alright, but yeah, that's right. Yeah, it's best for the specialist to do those things, but I will push it through as an urgent. Okay, don't worry though, I'm not going to finish there. As I said, I'm going to do those little checks now. Alright, and then I'm going to do your prescription, and I will sort the referral out. Okay. And then what I'm going to do, my love, is give you a nebulizer. Alright, and some oxygen. And then I will come and check on you. Alright, and see if you're alright to go home. Yeah. If I am concerned though about anything after you've had the nebulizer, or you know things haven't totally gone, I will have to keep you in overnight, and then I can get the appropriate people to come and see you. Yeah, in the criminology department. Yeah. Alright. Yeah, no, definitely not a trapped nerve. No. Am I okay to proceed? Right. Let me know if you feel any pain or anything, okay? This will feel a bit strange. I'm just moving the trachea. Pain. Can't feel any swelling, which is good. Swing out onto your upper chest by your collarbone. It feels really good. Great. Okay, I'm just going to feel a little bit around your ear. Wonderful. I'm just going to pull down your eyes. And just up. Excellent. Right. How are you doing? Good. There's definitely no issues with your glands, sinuses, or throat, or trachea, or anything like that. And you seem to be talking okay. No cutting out or anything like that. So that's all good. Fantastic. Right. Let me do this prescription. You're allergic to anything? Okay. Right, here is your prescription. Would you like to take that? Thank you. So, I am going to get you to a specialist. I'll sort that out for you. So, So I'm going to give you some anti-inflammatory. So you have a drink of water there. If I could get you to take the anti-inflammatory and the paracetamol now. Okay, I'm going to give you the nebulizer. All right, I'm going to go away and I'm going to come back in about an hour. Yeah? Yes, that's right. And then I'm just going to make sure that everything's okay and we'll go from there. Whether I want you to stay in or... Alright, my lovely. Okay, you can just take those two there. Thank you. And if you can just take those two. Thank you. Great. Fantastic. If you could just pop that over your head and have that like so. There we go. And then I'm going to hook this up to that. Great. Perfect. And then I'm going to there we go. Just nice normal breathing for me. Okay. So you're looking a lot calmer and relaxed. And hopefully this will actually get rid of it completely for you. Alright. You're very welcome, my lovely. You take care now. Bye-bye.